So the different imaging modalities that use in assessment of endocrine system include X-rays. We mean by X-ray, plain X-ray or conventional X-ray, ultrasonography, ultrasound, composite tomography, CT, magnetic resonance imaging, and nuclear medicine, scintigraphy, radioisotope scan or scintigraphy scan, and angiography. But those are the imaging methods or imaging modalities that utilize an assessment of endocrine system. In general, what are the indications for imaging of the endocrine system in general for any glands, or these are the indication for general indication for the imaging of endocrine system. First, in the diagnosis of endocrine tumors. There are many endocrine tumors can be diagnosed by the different imaging modality and endocrine tumors in the, for example, in pancreas, thyroid, adrenal gland, so on. Localization of endocrine active tumor. There is a, when there is an active tumor, active nodule, for example, in the thyroid gland, or to also assessment of ectopic hormone producing tumors. For example, secretion of the ACTH by the lung tumor, in a small lung tumor, because there is a hormone can be excreted by tissue, abnormal tissue in other in other place, in abnormal localizing tissue. This tissue may excrete hormone. For example, as we mentioned, ACTH can be excreted by the lung tumor. Evaluation of systemic complication when there is a complication, parathyroid hormone or thyroid hormone can cause a systemic abnormality or complication, such as parathyroid abnormality or hyperparathyroidism or hypoparathyroidism. Those are the general indication for any gland. Now we are going to specify the different gland. We start with pituitary gland, master gland. Indication for this pituitary gland imaging may include hormonal dysfunction. When there is a hormonal dysfunction, as you know, pituitary gland can secrete many hormones, such as growth hormone, thyroid stimulating hormones, prolactin, vasopressin, and so on. And when there is a increase or decrease function of this, when there is increase or decrease level of this hormone in the blood, this may be or an indication for imaging of this pituitary gland to know the cause of this abnormal functioning pituitary gland. Cushing syndrome, growth hormone abnormalities. This can be increased growth hormone or decreased hormone. As you know, increased growth hormone levels may cause acromegaly, and growth hormone deficiency may cause dwarfism. Or when there is many symptoms such as visual abnormalities, because when there is a tumor in the pituitary gland, this may cause visual abnormalities, may be ended by blindness or blurring of vision and blindness. Headache may be also cause of pituitary gland abnormality, pituitary adenoma, pituitary macroadenoma, and so on. But those are the indication of pituitary gland imaging. So, although we are going to give you a brief information about the pituitary gland, concentrating on the imaging of this gland. As you know, there is no blood-brain barrier in the pituitary gland. What does this mean? This means when we give the patient contrast, contrast is the dye that may be given intravenously. In this case, for imaging of the pituitary gland, the patient receives intravenous contrast. But this contrast circulates in the blood, and it can enhance the pituitary gland because there is no blood-brain barrier. This blood-brain barrier prevents enhancement of this pituitary gland by enhancement of any tissue by the contrast. But in this pituitary gland, specifically, there is no blood barrier. This makes this contrast to enhance this pituitary gland normally. So pituitary gland may be enhanced by circulating contrast in the blood, and so the pituitary gland enhancing by this contrast or taking the contrast normally. The MRI is the imaging modality of choice for diagnosing pituitary gland. Why? Because MRI, as you know, has a superior contrast in resolution. The contrast for soft tissue is better, or is best in the MRI. So MRI is the imaging modality for imaging of pituitary gland. Also, MRI, as you know, use no ionizing radiation, and also MRI can show the neighboring structure. When we do pituitary gland MRI, you can assess the surrounding tissue, cavernous sinus, sphenoid sinus, and suprasellar region. All this adjacent structure can be evaluated by the MRI. So this makes MRI is the superior modality or the investigation of choice for imaging of pituitary gland. Also, you have to know MRI in generally is poor in assessment of the bone in general. The pituitary gland is located in the suprasellar, in the sella turcica. So as to assess the bony region of the pituitary gland is less by the MRI, and computed tomography CT can show the this bone. So CT is better than MRI in assessment of the bony region, but MRI is better than CT in assessment of the soft tissue. The gland is soft tissue structure. In general, MRI is the investigation of choice for demonstration of the pituitary gland for this reason. Because it is superior than CT in assessment of the soft tissue, and it can assess the surrounding structure. It uses no ionizing radiation, but it is poor in assessment of the bone. So CT is better than the MRI assessment of the bone, the sella turcica or sphenoid bone. As you mentioned, pituitary gland is located in the sella turcica, which is a part of the sphenoid bone, which is the curved part of the sphenoid bone. This sella turcica is located in this area. It is located in this area, a curved area in the sphenoid bone. It is and it is called master gland. Pituitary gland has also composed of two lobes, anterior lobe and posterior lobe, two lobes connected to the optic chiasm by the infundibulum stalk. This is the anatomy of the pituitary glands, the location within the sella turcica. Inferior to the pituitary gland is located the sphenoid sinus. Sphenoid sinus is inferior inferior anterior to the pituitary gland. This is the landmark. Usually we depend on it to see or to localize the pituitary gland on the different imaging modality. This is a plain X-ray. Why this is a conventional X-ray or plain X-ray? Lateral view. This is a lateral view. In this area, in this part, you can see the sella tersica. Within this fossa, hypophyseal fossa, the pituitary gland is located. Nowadays, this plain X-ray is not done frequently to assess the pituitary gland. In the past, we use this plain X-ray to assess the pituitary fossa, to assess if there is erosion or enlargement of the pituitary area. You have to know pituitary gland itself. It's not displaying the plain X-ray, but you can see the sella tersica. When there is a tumor in the pituitary gland, this may cause enlargement of this fossa or increase the diameter, especially the AB diameter. And also may cause erosion of this sella tersica. Nowadays, this plain X-ray is not used or performed to assess the pituitary gland. We replace this by CT when we are interested in the bone. This is obsoleted technique in assessment of the pituitary gland. But you have to know this is the area of pituitary gland in hypophyseal fossa within the sella tersica, and the sphenoid sinus is located anterior to the pituitary gland. This is called lateral view to demonstrate this is a magnified image of the skull X-ray to see the anatomy in this area. But this is a sphenoid sinus. You have to know the relation between sphenoid sinus and the sella tersica, in which the pituitary gland is located. In the bottom, this is a floor of the sella tersica, anterior colonoid process and posterior colonoid process, and this is the dorsum sellae. This is the anatomy in this area. Also, this is the pituitary hypophyseal fossa, or the area of the pituitary gland, with the same anatomy. Floor of the sella tersica or pituitary fossa. This is the pituitary fossa. This is the floor of the pituitary fossa. The posterior colonoid process and anterior colonoid process and dorsum sellae. So this is a magnified image to demonstrate the anatomy of the sella tersica. As I mentioned, this CT is another technique that used for assessment of the pituitary gland, but it is not the investigation of choice. It is usually done when we are interested in the assessment of the bone, to look for the bone erosion or to look for the sella tersica in general. This is the area of pituitary gland, temporal lobe in other side, in either side. But this is the area of the pituitary gland. And this is a CT axial cut. This is axial cut, and this is CT coronal. CT coronal. This is sphenoid sinus, and this is the area of the pituitary gland. Lateral to the pituitary gland, there is a cavernous sinus. Cavernous sinus are located in either side of the pituitary gland, on the right and left of the pituitary gland. And the most important structure that seen in this cavernous sinus is internal carotid artery. There are many other nerves, but the internal carotid artery is the most important structure that seen in the cavernous sinus. But when there is the abnormality in the pituitary gland, you have to look to the cavernous sinus to assess invasion of this cavernous sinus by abnormality in pituitary gland or not. This is CT axial cut. As you know, to differentiate between the CT and MRI, in CT, the bone is very dense. The bone is very dense. And in X-ray also, as it uses X radiation, also the bone is dense, but it's less denser than the in CT because both technique use X-ray. This is MR for the pituitary area. It looks like a lateral X-ray, but with more details because the soft tissue resolution is better in MRI. You can see the brain details and you can see the area of the pituitary gland. This is a sphenoid sinus. Above the sphenoid sinus is the area of the pituitary gland. If you look carefully, the bone is not seen, as you mentioned. MRI is very poor in demonstration of MRI. You have to, of bone. You have to put this in your mind. Cortical bone is not displayed by the MRI. It's a signal void. It does not give us any signal. The cell tersica itself is not seen in this MRI, but you can see the pituitary gland. This is the area of pituitary gland. And superior to the sphenoid sinus. Sphenoid sinus is appear as hypo-intense plaque, hypo-intense. But this is a soft tissue signal intensity of the pituitary gland. Also, this is a sphenoid sinus. Above the sphenoid sinus is the pituitary gland. Pituitary gland connected to the optic chairs by this pituitary stalk or infundibulum. This infundibulum connects the optic chairs to the pituitary gland. This is the anatomy of the pituitary gland. This is magnified MRI sagittal. This is MRI also sagittal view. This is MRI sagittal. This is MRI sagittal, and this is MRI coronal. If you look, the bone is black. This bone is black. This area bone is black. The bright one is the soft tissue, is the fat. This is the fat. The bone is black. This is sphenoid sinus. Above the sphenoid sinus is the pituitary gland. This is the pituitary gland. Lateral to the pituitary gland قلنا عندنا cavernous sinus. In the most structure that could be seen in this area is internal carotid artery. This is a pituitary gland connected to the optic chairs by this infundibulum or pituitary stalk, connecting the optic chairs to the pituitary gland. The pituitary gland is located in this area, cella tersica. MRI is very poor in demonstration of the bone. This is a coronal MRI, coronal section of the brain at the level of the pituitary gland. My question, what is the best imaging modality for pituitary gland? Anyone?
MRI.
Yes. Why?
You can assess the soft tissue.
Yes.
Yeah, without the bone.
Yes, it is a good imaging modality for soft tissue. It uses no ionizing radiation. It can assess the neighboring structure, but it is very poor in what? In assessment of
bone
structures. Is X-ray can be used for assessment of the pituitary gland itself?
No.
Why? Right.
It's not able to detect the soft tissue completely.
Yes, thank you. Because X-ray is very poor in detecting or displaying the soft tissue, pituitary gland, the soft tissue. But X-ray can see the cella tersica. But nowadays is not used frequently to assess the alignment of the cella tersical region by this letter C. What is the best imaging modality of this imaging modality for assessment of the bone erosion?
CT.
Yes, CT is the, yes, you are right. CT is the best imaging modality or can be used for assessment of the bone or the يعني هنا المقصود به ايش؟ the cell sphenoid sinus sphenoid bone. فنعرف انه الاكس راي can demonstrate the bone erosion or enlargement of cell tersica, but nowadays not use CT, used for assessment of the, if you are interested in the assessment of the bone, MRI is the best imaging modality in general for assessment of the pituitary gland for the mentioned reason. Ultrasound nuclear medicine not used commonly for assessment of the pituitary gland. So what is this imaging modality?
This is MRI.
MRI, yes, this is MRI with contrast, but this is, what is the plane or the section?
Sagittal view.
This is a sagittal view. طيب, what is this?
So pituitary gland, but abnormal.
Yes, this is area of pituitary. It is abnormal. The pituitary region is occupied by this lesion. So there is a mass in the hypophyseal fossa or pituitary fossa. This is the abnormal lesion in the region of the pituitary gland. And what is this imaging modality?
CT scan, because it dense.
CT scan. Yes, this is a CT scan. As CT is usually axial unless we do reconstruction into coronal or sagittal. Also, you can see this is this lesion in the area of the pituitary gland in this CT. You are not responsible of the pathology, but I present this image to compare between the normal area of the pituitary gland in CT and MRI in the previous line to compare it with abnormal region of the pituitary gland. Those are MRI and CT for, yes, welcome.
So the CT, the bone will be hyperdense, and in
Yeah.
MRI will be hypodense, the bone.
But in MRI, don't say hyperdense in MRI. In MRI, what is the term for the
Hypotense.
hypointense? Yes, hypointense or of no signal, totally black, no signal. And in the CT, it is hyperdense. Density for we use the term density for CT, but intensity for the MRI. Yani this is hyperintense lesion, and this is hyperdense. Density on MRI and intensity or signal, high signal or hyperintense on MRI, and hyperdense in CT or of high attenuation. High attenuation also means bright, very bright. These are the terms that used in CT and MRI. The other gland is pineal gland, which is the midline structure situated between the two salami, situated by the two salami at the and posterior to the third ventricle. Pineal gland is أهم كلمة تعرفين it is a midline structure. It's located in the midline between the two salami or thalamic body, and it is usually posterior to the third ventricle. This is the normal position of the pineal gland, midline between the two salami and posterior to the third ventricle. This pineal gland is normally calcified. It can demonstrate calcification. What is the best imaging modality that can demonstrate calcification?
CT.
Yes, and to less extent, what other?
X-ray?
X-ray, all right, thank you. But MRI is very poor in demonstration of calcification. For calcification in pineal gland can be almost always visible on CT. It is normally seen in pineal gland, especially after the age of even 5 years, this pineal gland develop calcification. Pineal gland also, in pineal gland there is no blood-brain barrier, such as in the pituitary gland. So also this pineal gland may be normally enhanced by contrast. يعني مثل البينيال gland can take the contrast normally. It can be enhanced by contrast normally because also there is no blood-brain barrier. Now blood-brain barrier prevents enhancement of normal structure by contrast. But when there is no blood-brain barrier, the structure may be normally enhanced by contrast that's circulating in the blood. Also, MRI is the modality of choice for assessment of pineal gland. And although this modality is poor or not sensitive in assessment of the calcification. لأنه عارفين ال MRI هي very poor in calcification or assessment of bone. لأن calcification في النهاية or the bone is in calcification. The MRI also is the modality of choice for evaluating the pineal gland. بالرغم من انه it is not sensitive in demonstration or of assessment of calcification. It is very poor and or very insensitive to assessment of the calcification. How this pineal gland appear on MRI? On MRI, this pineal gland appear as a small nodule of tissue with similar intensity, or similar intensity means iso-intense to gray matter. So pineal gland on MRI, how it appears? As a nodule, a small nodule. The intensity of this pineal gland, لاحظوا انه قلنا شنو intensity, because we are talking in MRI. The intensity of this pineal gland is iso-intense to gray matter. This can be seen in this. What is this imaging modality?
MRI.
Which plane or section?
Sagittal view.
Yes, right. Thank you. This is the pineal gland. طبعا هنا من الساجيتال difficult to إنه تعرف إن this is a midline. It is in the midline and this section on the midline at the area of the corpus callosum, at the level of the corpus callosum. But this is pineal gland. It is the intensity of this pineal gland is similar to the what?
To the gray matter in the brain.
Yes, gray matter in the brain. But this is the intensity. It is a similar intensity to the gray matter of the brain. But this is the pineal gland appear as a nodule of soft tissue. The intensity of this nodule is similar, or similar means iso-intense to the gray matter of the brain. But this is the pineal region. So you have to look to know the anatomical position of the pineal gland on MRI. But this is a pineal. Yes.
Can you show the pituitary gland here?
Pituitary gland. What is this?
Supernodal air sinus.
Yes, you have to look above to this. For this is what?
Pituitary gland.
Pituitary gland.
This is a pituitary gland. This is sphenoid sinus, and this is a pineal gland. MR on this MR, yes.
Doctor, when it says calcification, does it refer that it shows a brighter color, like it's much more brighter?
Yes, the calcification on CT appears as hyperdense bright, but on MRI it is not displayed. On MRI, the area of calcification appear of low intensity, appear as black areas. But on CT, the calcification appear as hyperdense bright on CT. MRI very poor in demonstration of this calcification. What is this imaging modality?
I believe that's MRI.
Sagittal MRI.
Yes, sagittal MRI. Where is this lesion is located? In the area of what?
The midline structure, so pineal gland.
Yes, this is the area of pineal gland. But this is a tumor or lesion in the area of pineal gland. What is this imaging modality?
Like CT scan?
Yes, this is a CT.
Coronal.
Yes, if you look carefully, this midline structure, this is the area of pineal gland. Why? Because it is a midline between the two what? What is the structure? Yes,
Stomach bodies.
salama. Yes, these are the salami on both sides, and posterior to what?
Third ventricle.
Third ventricle. This is a third ventricle. This area of pituitary is of pineal gland. Why? Because this is a region of pineal gland posterior to the third ventricle and between the two salami. What is this?
I think this is the calcification on the pineal gland.
Yes, thank you. This is the calcification. Calcification, very dense like the bone. This is a, so CT can demonstrate the calcification, but calcification cannot be displayed or seen on MRI. This is a advantage of CT over the MRI, can demonstrate the calcification. What is this imaging modality?
I believe that's MRI as well.
Yes, this is MRI. Which plane?
Surgical MRI.
Yes, what is the area of this abnormality?
It's the pineal gland.
Pineal gland.
This is
Tumor.
the region of pineal gland. There is describe this lesion by the terminology used in the MRI.
It's a
Isointense.
ISO.
It's a midline structure that is laterally placed between the cell-like bodies and posterior to the third ventricle.
Yes, you are right. But what is the intensity of this lesion?
Oh, isotense in that case.
Isointense to what?
Gray matter.
Yeah, this is a gray matter, and this is a lesion. Is it similar intensity to the gray matter?
Yes, doctor.
Yes, yes. Look again. This the intensity in this lesion. Is it similar to these areas? This is
No,
abnormal.
Hyperintense.
Yeah, this area is more plaque than this, but this is a hypointense to the gray matter in this. This is abnormal lesion. In normal pineal gland, the pineal gland intensity is similar to the gray matter in normal, but this is abnormal. But this is hypointense. Hypointense means plaque in MRI of low signal compared to the gray matter. You are not responsible of this, but I give you some information to help you in the future. This is a hypointense compared to this gray matter. What is this imaging modality?
I think that's MRI.
Yes. Or
CT?
one MRI. Yes, your MRI.
Yeah.
This is a fat in the subcutaneous fat. The bone here, the bone is plaque. Bone is plaque, and the soft tissue resolution is better than in CT. This is a MRI. Where is this abnormality or this lesion?
It's in the middle.
It is a midline.
Midline.
Yes.
And in front of it, the third ventricle. So that would be pineal gland, but it's a lot bigger.
Yes, it is posterior to the third ventricle, and those are the what are these?
Thalamic bodies.
The thalamic bodies. Yes, this is a region of pituitary gland. Also, you are not responsible again for this abnormality, but to compare the region of normal and abnormal. This may to fix your knowledge, it stimulates your understanding of this normal and abnormal. If you look to normal and abnormal, you may be familiar with the normal region. The next gland is thyroid gland. Thyroid gland.
Doctor,
yes.
So for pineal gland, the best is MRI, right?
Yes, pineal gland is the best imaging.
Even though it's not good for calcification.
Yes, but here in general, MRI is the imaging modality of choice for imaging of the pineal gland. But for demonstration of the calcification, CT is the best than MRI.
Doctor, for
Yes.
just for the absence of blood-brain barrier on both pineal and pituitary gland. So when it says that it will normally enhance by contrast, does it mean like the contrast age is given to is going to have a darker color, something like that, or?
Yes, this means you have to know the normal enhancing tissue or organs or tissue by the contrast, because many tissue may when they enhance by contrast, this may be abnormal. So you have to put this in your mind. In this pineal gland and pituitary gland both have no blood-brain barrier. So when we see contrast, or when this tissue attacks the contrast, this is regarded as normal, not abnormal. You got me?
Okay, so it would be considered normal for those two, but abnormal in other tissues.
Yes,
blood-brain barrier.
yes.
Okay, doctor.
The next gland is thyroid gland. Thyroid gland is normally imaged by ultrasound. Any patient present with thyroid abnormality, normally this patient normally imaged by ultrasound. Ultrasound is the imaging modality that can differentiate between the cystic and solid nature of the any abnormal lesion. يعني هنا مثلا نتكلم عن thyroid gland, ultrasound can differentiate between the nature of the lesion. Is it cystic or solid or both? Mixture of both. إذا ultrasound أهميته إيش؟ إنه he can differentiate between if there is a lesion in the or tumor or lesion in the thyroid. The ultrasound help us in differentiation between the nature of this tumor. Is it cystic or solid? Because this is important in differential diagnosis or to reach the diagnosis. Ultrasound help us in differentiation between the nature of this tumor or nodule. Is it cystic or solid? Also, ultrasound can be used for guidance for fine needle aspiration. Fine needle aspiration for cytology. Ultrasound can be used for guidance of this fine needle aspiration, which now becomes the mainstream diagnosis of thyroid cancer. And nowadays, to diagnose the malignancy, thyroid malignancy, the FNA must be done. And this FNA done under guidance of the ultrasound. Also, thyroid can be assessment by nuclear medicine or scintigraphy techniques. The scintigraphy or nuclear medicine here diamond help us in assessment of the function of the structure or tissue rather than anatomical. But this is, if you are interested in the assessment of the function of the thyroid, scintigraphy or nuclear medicine can help us in this particular part for assessment of abnormal thyroid function. CT is not used commonly in assessment of the thyroid gland unless there is a extension of the thyroid retrosternal goiter. There is a retrosternal goiter. سابقا برضو كانوا بيعملوا ايش حاجه اسمها thoracic inlet X-ray to assess extension, retrosternal extension of the thyroid gland. Nowadays, we can use CT to demonstrate the extension of the goiter retrosternally. اللي هو plain X-ray قلنا كانت تستخدم في assessment of the intrathoracic thyroid مثلا اللي هي retrosternal goiter. لكن nowadays it is not used commonly. We use CT instead of plain X-ray. But both can demonstrate the extension of the thyroid gland into thoracic. To conclude this slide, إنه نعرف إنه the most common imaging modality that used in assessment of thyroid gland is ultrasound. Also, the ultrasound help in differentiation between the nature of the nodule, thyroid nodule. Is it cystic? Is it solid? Or both? Also, ultrasound can be used for fine needle aspiration for guidance of this needle, which is military diagnosis technique for diagnosis of thyroid cancer. Scintigraphy or nuclear medicine technique used for when we are interested in the function of the investigation of abnormal thyroid function. CT not used. It is not used commonly, but it can be used in when there is an extension of the goiter, retrosternal. When there is retrosternal extension of the goiter. Also plain X-ray, but CT is used commonly than plain X-ray in intrathoracic extension of the thyroid masses or goiters. What is this imaging modality?
Ultrasound.
This is ultrasound. This is a transverse section at the level of the thyroid gland. What is this?
This is left lobe of the thyroid.
This is the left lobe. This is the left side, and this is the right. And what is this? This is the right lobe. And what is this?
The isthmus, the one in the middle.
Isthmus, which is connected both lobe. The isthmus in the center connected the both lobe. And what is this?
Trachea.
And this one?
And I think this is an artery.
Yes. Which is this artery?
Posterior
Internal
lateral. Common carotid
Yes.
artery.
Yes, is a carotid artery. And what is this?
Next to it, internal jugular vein.
This is a jugular vein, and this muscle is sternocleidomastoid.
Sternocleidomastoid.
Yes, this is sternocleidomastoid. So this is a normal axial or transverse section at the level of the thyroid. By the ultrasound demonstrates the both thyroid lobe connected in the center by the isthmus. This is trachea, and those the carotid and jugular vein laterally. This is a normal thyroid ultrasound. Again, what is this?
It's the left lobe.
And this is a
isthmus.
And this is
sternocleidomastoid.
So also again, this is a normal ultrasound of the thyroid. You can see the both lobe on both sides connected by the isthmus in the center. What is this imaging modality?
CT scan.
Why?
Because you see the vertebrae is very white.
Yes, thank you. You can see the vertebrae is very white or very what in CT?
Dense?
Yes, thank you. This is very dense vertebrae in CT. What is this?
Should be the trachea in the middle.
Yes, this is trachea in the middle, yes. You can see on both sides. What is this?
It's the thyroid gland, the
Yes,
isthmus and the
thyroid
two
gland.
lobes.
Yes, and what is this imaging modality?
It's ultrasound of the thyroid gland.
Medicine?
I mean,
This is
not ultrasound.
Yes,
nuclear
this is
medicine.
nuclear medicine, radionuclide or scintigraphy of thyroid gland. You can see both lobe. There is an uptake of the radioisotope. This both thyroid gland shows the radioisotope uptake by the thyroid gland. This is a radionuclide image of thyroid tissue. Shows the function of the
Uptake means hyperfunction, right?
This is an uptake. When we say an uptake, it may be normal uptake, but when there is increased uptake or decreased uptake, this is regarded abnormal. But now there is intake, normal uptake by the of the radioisotope by the thyroid gland. This is a normal uptake by both lobe. There is no increase of uptake or decrease of uptake. This is a normal uptake of the radioisotope by the thyroid lobes. But this is also normal uptake of the radioisotope by the both lobe of thyroid gland. But this is a patient present with muscle weakness, sleeping problems, and fast heartbeat with poor tolerance of heat and diarrhea and weight loss. This is what is this imaging modality or imaging technique?
Nuclear medicine.
More uptake.
Yes, this is a nuclear medicine or radioisotope or scintigraphy of the thyroid. Compare this with the, what is the difference between the two?
I think there's an increased thyroid
Increase uptake.
function.
Yes, there is increased uptake. There is increased uptake. It gets more plaque. There is increased uptake of this radioisotope. And also you can see the size. Compare the size.
It's a lot bigger.
Yes,
compared to the
Larger.
left.
it gets bigger. There is enlarge of both thyroid gland with increased uptake. But this is Graves' disease. Also, you have to know the normal and this is the normal. In Graves' disease, there is increased uptake with enlargement of the thyroid gland. What is this imaging modality?
MRI.
Why?
Vertebrae.
Why it is, yes, vertebrae is what?
Vertebrae.
Why it is not CT?
You see the vertebrae down below. There's density.
Density. Don't say density on MRI. On MRI, you have to know the term for MRI imaging. MRI, we talk about the intensity. The intensity of this is a ISO intensity is not very bright like CT, but this is a MRI. What is this structure? Yes, and what is this? What is the
Thyroid
structure?
gland.
This thyroid gland engulfing the trachea. طيب the next
دكتور بس عندي سؤال في ال
yes
في الراديو ايزوتوب
radioisotope yes
هلا بيعمل انديكيت للمور ابتيك. طب اذا كان في لسه ابتيك، اذا كان عنده هايبوثايرودزم بيبين ولا لا؟
yes it can if there is a يعني يعني مثلا hypothyroidism or hyperthyroidism, it may be يعني function can be assessed by the uptake of the radioisotope can be demonstrated in the radioisotope study. حتى عم نعمل thyroid function test اللي هي blood taking blood to assess the thyroid function. But in the nuclear medicine, this also function can be assessed by giving the patient iodine 123 and for 24 hours, and then we scan the thyroid to see to assess this uptake of the iodine by the thyroid gland. So, to answer your question, when there is increase or decrease, يعني hypothyroidism or hyperthyroidism, this can be assessed by the nuclear medicine or radioisotopes.
شكرا.
دكتور يعني الهايبوثيروديزم حيكون كذا أكثر بلاك ولا حيكون أبيض less black؟
according to the cause، يعني احنا بعد الباثولوجيز عندها manifestation according مثلا عندنا thyroiditis ولا اللي هو مثلا عندنا Graves' disease according to the cause. يعني ما بقول لك انه usually it is hypo. Yes.
Sorry, doctor. My question is: the hypo is the same as the hyper, like this, more black or not?
In Graves' disease, there is increased uptake. Here, Graves' disease, there is increased uptake of the radioisotope by the thyroid gland. عندنا any pathology عندها specific appearance. يعني مثلا إذا عندنا if there is a nodule it could be demonstrate high uptake or low uptake or no uptake. يعني any nodule يعني بعدك حتى هنضع differential diagnosis according to this appearance. If there is increased uptake on this nodule or decreased uptake or of low uptake in totally, anyone have a differential diagnosis. I'm not interested to talk about this at this level يعني. Parathyroid, parathyroid. In general, parathyroid is not seen by the ultrasound parathyroid unless there is abnormality. يعني parathyroid itself it is usually difficult to be seen by ultrasound unless there is adenomas. So parathyroid adenoma may be detected on ultrasound. be posterior to the thyroid. But normal parathyroid is not easy to be detected by ultrasound. Small parathyroid adenomas can be detected by ultrasound, but normal parathyroid difficult to be seen by ultrasound. يعني إلا يكون عندنا adenoma, even small adenoma can be detected by ultrasound, but normal parathyroid difficult to be seen by ultrasound. So the most widely used or commonly used technique for assessment of parathyroid is radioisotope or radio scintigraphy or nuclear medicine. What is this imaging modality?
So is it radionuclide scan or nuclear medicine?
Yes, this is a nuclear medicine or radionuclide scan. This is done as after 15 minutes from the taking of the radiopharmaceutical. This is the area of the thyroid and parathyroid gland, and this is also imaging of the scintigraphy. 2 hours, you can see still there is hot nodule or increase uptake or hot nodule في اللاب means hot nodule or increase uptake. لأنه عندنا المفروض بعد 2 hours this is a normal, right? This is normal, but still the left one عندنا there is still the radiopharmaceutical or radioisotope still seen in this. This is a parathyroid hyperplasia. This is a parathyroid hyperplasia. طبعا بيكون عملوا other modality, عمل ultrasound, and this is مثلا ultrasound demonstrates this parathyroid adenoma, and this is a soft tissue lesion, but this is cystic lesion. This is cystic lesion, and this is soft tissue lesion. طبعا the ultrasound usually difficult to be يعني تعرف انه the anatomy لانه it depend on the operator. يعني الاوبريتور بيكون اخذ الايمج على المنطقه دي. يعني انت you are not now see the adjacent structure. يعني it is not يعني image for the all areas. It is only demonstrates the lesion. This is a parathyroid adenoma, and this is a parathyroid cystic lesion, cyst, and this is solid lesion. This is a parathyroid. This is a nuclear medicine or scintigraphy demonstrate the parathyroid hyperplasia. اللي هنا نعرف من انه this is a region of the thyroid and parathyroid. نحن قلنا the parathyroid is usually assessed by the nuclear medicine or radioisotope.
Doctor,
yes,
I
welcome.
think what do you mean by 15 minutes or 2 hours? What's the difference?
15 minutes and 2 hours?
Yeah.
Yes, this is 15 minutes, the time of the scan. It is 15 minutes after the injection of radioisotopes.
And is this normal in 15 minutes?
Yes, in 15 minutes it is normal, but in 2 hours this يحصل لها wash out of this radioisotope, but this is still seen in this left parathyroid. This is a parathyroid hyperplasia. يعني this is a normal at this time. After 2 hours, normally the right side is normal, but the left one is not. The next gland is adrenal gland, suprarenal gland. As you know, in the anatomy, the right adrenal or suprarenal gland is situated above the upper bowl of the right kidney, and the left one usually situated just anterior to the upper bowl of the left kidney. So we call them suprarenal gland. Enlargement of the adrenal gland can be demonstrated by CT and MRI, and sometimes by ultrasound. When there is enlargement of the adrenal gland, this can be recognized on CT and also on MRI, and sometimes on ultrasound. But CT is the best imaging technique for diagnosis of adrenal gland enlargement. Why? Because it is constantly shows the size and shape of the gland. يعني CT is the best. يعني عندنا we are suspect enlargement of the adrenal gland. CT is the best technique for diagnosis of adrenal gland enlargement. The nuclear medicine also can be used for localized functioning of adrenal tumor. يعني لاحظ انه radionuclide or nuclear medicine usually demonstrates the function rather than the anatomy. يعني the function of the adrenal gland can be assessed by radionuclide or scintigraphy. normal adrenal gland are rarely visible in adult by ultrasound. لكن في طبعا في البيدياتريك group يعني الادرينال gland is bigger than in adult. يعني in pediatrics normal adrenal gland can be seen by the ultrasound, but in adults it is rare to be seen by ultrasound this adrenal gland. Also to conclude this slide, تعرف ان the normal position of both right and left adrenal gland and the best technique for assessment of enlargement of the adrenal gland CT, although both CT and MRI can demonstrate enlargement of the adrenal gland, and ultrasound occasionally demonstrates the enlargement of the adrenal gland. And to assess the function of the adrenal gland, radionuclide scan can be used. Adrenal gland in adults difficult to be seen or rarely visible in ultrasound, but in pediatric age group it can be demonstrated. What is this imaging modality?
CT scan.
What is the plane?
I think this is axial view.
This is axial view. Thank you. طيب, this is the adrenal gland. This is the, is it this left or right?
I think this is left.
This is the left adrenal gland. This is the left adrenal gland. This is a magnified image of the CT to demonstrate the adrenal gland. This is the right adrenal gland, and this is the left adrenal gland. The right adrenal gland is, what is this structure? This one.
Pancreas.
This one. This.
I think this might, if it's behind it, maybe it's part of the diaphragm, or
What is this?
Aorta.
And what is this?
Inferior vena cava?
Yes, this is inferior
Yes.
vena cava. Yes, this is inferior. You are right, thank you. This is a inferior vena cava. So the, what is the relation between the IVC and adrenal gland?
Anterior to it.
Yes, the adrenal gland is located anterior to the inferior vena cava, and it is, what is the what is this structure?
This should
Kidney.
be the kidney.
Yes, and what is this?
Liver, right pole
Yes,
of the liver.
right. Yes, what is this?
I think this is
If
an artery, but I'm not sure.
If you know this,
Uterus. Urethra.
Diaphragm.
yes, thank you. This is a diaphragm. This is a crura of diaphragm. This is the right crura. So the pituitary, the adrenal gland, right adrenal gland is located between the medial to the right hepatic lobe and anterior to the IVC and lateral to the crura of the diaphragm. This is the position of the right adrenal gland, and this is the left adrenal gland. It is seen between the anterior to the pancreas or the splenic vessels, in this splenic vessels, and the lateral to the aorta. This is the position of left and right adrenal gland.
Where is the right adrenal?
This is the right, this one.
So it's posterior to the IVC.
It is posterior to IVC, yes. This is IVC, it is posterior to IVC.
Okay.
Yes. CT. What is this imaging modality?
CT scan, definitely.
What is the plane?
Coronal section?
Yes, this is a coronal cell here. Thank you. This is the left and right also adrenal gland. This is the right and left adrenal gland on CT. What is this imaging modality?
Nuclear medicine.
This is
already.
a nuclear medicine. Yes. What is what is this? What is this structure?
Left kidney,
Yes. And what is this?
right kidney.
Just are the calyces and the pelvis. And what is this?
Which should be left adrenal gland.
Yes, this is the left adrenal gland, and this is the
Right adrenal gland.
right. So this is the left adrenal gland. This is the right adrenal gland. You have to look care for this image. These arrows pointed to the adrenal glands, right and left adrenal gland. Those are the right and left adrenal gland. You can see the radioisotopes is excreted by the kidneys into the urine, through the urine to the urea bladder. And you can see also there is a radioisotope in the urine system in general. And also, what is this?
Could that be the heart?
Skeleton.
Yes,
Is that the heart, doctor? Or
this is a
Apex of the heart.
any other opinion?
Spleen.
stomach?
Yes, other opinion. Yes, this is a heart. This is a heart. This is a heart, and this is a renal system, and this is a suprarenal, right and left suprarenal. And what is this?
Maybe
Sinus.
Yes.
Sinus.
All right. What? What?
Are those sinuses, doctor, or thyroid gland?
Yes, this is thyroid gland. Yes, thyroid gland. This what is this imaging technique?
Ultrasound.
You can see this is the adrenal gland. This is the adrenal gland. When ultrasound can show the alignment of the adrenal gland, but occasionally, and ultrasound can demonstrate the adrenal gland in the pediatric age group rather than in adult. Difficult to see the normal adrenal gland in the pediatric. This is ultrasound of normal adrenal gland on both right and left. What is this imaging technique?
MRI.
Was demonstrate both adrenal gland, and those are the kidneys. This is a MRI demonstrate the adrenal gland. Also, this is MRI axial. Also, you can see the adrenal gland on both sides. What is this imaging modality?
CT scan.
This is with which plane?
Axial view.
Yes, also this is the region of the left adrenal gland occupied by this lesion. This is a tumor in the left adrenal gland, and this is a right adrenal gland normal. There is a tumor in the left adrenal gland. So to compare also between the normal and abnormal adrenal gland region. This is also bilateral adrenal gland tumor. Bilateral adrenal gland tumor. This is the right and this is the left adrenal gland tumor in adrenal metastasis. What is the commonest cause of adrenal metastasis?
Lung cancer.
Yes,
Being the most
thank
common.
you. Yes, thank you. The next gland we are going to discuss is pancreas. CT is now the mainstay for imaging of the pancreas. The patient suspected pancreatitis or tumor. طبعا ultrasound can play a role in assessment of the pancreas, but CT is now the mainstay imaging of the pancreas in general. إذا كان عندنا suspected trauma, injury to the pancreas, acute pancreatitis can be demonstrated by ultrasound, but CT is the imaging modality of choice for assessment of the pancreas. The major advantage of CT over transabdominal ultrasound, نعرف إنه الالتراساوند is limited use in areas containing gas. يعني ultrasound propagation in any area containing gas is very poor. So this pancreas may be covered by the bowel or the stomach. Usually there is a difficulty in or in visualizing this pancreas by ultrasound. لكن the CT is can demonstrate the normal or abnormal pancreas more clearly than ultrasound. Also, endoscopic ultrasound is routinely used in diagnosis of the pancreas. واحدة من advantages of the endoscopic ultrasound, it can include biopsy. يعني you can take a biopsy with this endoscopic ultrasound. يعني we can take a biopsy from the lesion in the pancreas when we use this technique, endoscopic ultrasound. Endoscopic ultrasound done by insertion of the endoscope through the stomach, and this is a technique اللي هو بنقول شنو insert the endoscope which contain a probe, special designated probe to look for the stomach and the pancreas areas and so on. And this technique can help us in taking biopsy from the pancreas in patients with pancreatic cancer for staging. Also, again, CT is the investigation of choice or imaging modality of choice or the mainstay for imaging of the pancreas. ليش؟ لأن التراساوند is يعني عندها difficulty in assessment of any structure يعني ممكن يكون covering by the air or يعني neighboring to the air containing structure. I think in the normal anatomy, the bowel may cover the pancreas or also the stomach also may cover the pancreas. All this structure, stomach and bowel may containing air. This make assessment of this pancreas by ultrasound is poor. Endoscopic ultrasound is used commonly for diagnosis of pancreatic tumor, and this technique gives us have a role in taking for this from this. I'm going to give you brief information about the anatomy or imaging anatomy of the pancreas. The head of the pancreas is seen in the duodenal lobes. So for CT scanning, the duodenum is ossified by oral contrast. ليش؟ يعني احنا زادين نعمل if you are going to look for the pancreas, the density of the pancreas and density of the bowel is similar, almost similar. To differentiate between the lobe of the duodenal lobe and the pancreas, you have to give this contrast, this patient contrast orally to ossify this duodenum, to make this duodenum separate يعني in the image from the pancreas. لذلك, if you did not give the patient contrast orally to ossify this duodenum by contrast, it is usually difficult to differentiate between the pancreas and the duodenum. الكلام ده مهم جدا in the imaging. يعني لازم نحن if you are interested in the pancreas, you have to give the patient contrast. This contrast اللي هو قلنا ossifies the duodenum، بخلي الduodenum شنو more bright. This can make the differentiation between the duodenum and the pancreas easy, more easy. The body of the pancreas usually seen in front of superior mesenteric and vein and artery, and also the splenic vein is lying behind the pancreas. This is anatomical location of the pancreas. So the pancreas is located anterior to the superior mesenteric artery and vein, and also anterior to the splenic vein. هنشوف الكلام ده كله in the image. طيب نحن if we do CT for the pancreatic region, usually we can see the pancreas into portion or in different section. Why? Because this pancreas are running obliquely in the abdomen. نحن بنعمل axial, then we can take a portion of this pancreas in the next axial section. We can see the another portion. So because of the obliquity of the pancreas or oblique orientation of the pancreas, usually CT show different portions of the pancreas on various sections. نحن بناخذ section بنلقى انه في part of the pancreas, other section and other part. Why? Because the pancreas is running obliquely. It is not straight. The normal pancreas shows feathery texture. This is a normal pancreas shows feathery texture. اللي هي بيكون في lobulation. This lobulation interspersed with fat. This is a normal appearance of pancreas on CT. On ultrasound, the pancreas gives reasonably uniform echoes of medium to high level compared with adjacent liver. يعني the pancreas echogenicity on the ultrasound is similar or iso-intense to the liver. Also, to conclude this slide, you have to know the يعني انه اهم نقطه هنا انه the head of the pancreas is located within the duodenal lobe. This is يعني within the duodenal. يعني هو تلقى انه the pancreas is within the duodenal lobe. So يعني usually there is a difficulty in differentiation between the CT, between the pancreas, head of the pancreas especially, and the duodenum. To differentiate between the head of the pancreas and duodenum, the patient should receive oral contrast. This oral contrast opacifies the duodenum and make it easier to differentiate from the pancreas. And also you have to know the normal position of the pancreas to the vessels. It is in front of the superior mesenteric artery and vein, also anterior to the splenic vein. And also the you have to know why the pancreas seen in different portion. يعني ما بنلقى the whole pancreas in different section. Usually يعني ممكن sometimes ممكن نعمل CT تكون أخذت the section obliquely also. ممكن it can differentiate the whole length of the pancreas in one section. But most of the C section you can see the head, and the other section you can see the body, and the other section you can see the tail, because this pancreas running obliquely, not straight on the abdomen. The normal appearance of the pancreas is feathery texture corresponding to why? Because there is a lobulation of the pancreas, and the appearance of the pancreas on ultrasound is iso-echoic to the adjacent liver. But this is what is this imaging modality?
Ultrasound.
This is ultrasound. But this is the pancreas. This is a pancreas. This is axial cut on the pancreas. The pancreas is anterior to this splenic vein. This is splenic vein. This is splenic vein, and this is a portal vein, and this is superior mesenteric artery. This is superior mesenteric artery. But this is a relation of the pancreas to the vessels. This is a splenic vein. The pancreas is anterior to splenic vein and also anterior to the splenic artery. The splenic vein join the splenic, the mesenteric vein to form this, portal vein. Also, this is a pancreas. It is isoechoic to the liver. The echogenesis of the liver is similar to the echogenesis of the pancreas. This is a head, and this is a body, and this is a tail. This is a splenic vein, a splenic artery, and a splenic vein. The pancreas is located anterior to, this is anterior, and this is a posterior. This is a spine, this is a posterior. What is this imaging modality?
CT scan.
This is the pancreas. You can see this is the tail, and this is the body, and this is the head of the pancreas. the head of the pancreas is nestled within the duodenal cap. This is a duodenal cap, this one. And you can see this is a splenic vein. This is splenic vein, and this is a portal vein, and this is a superior mesenteric artery. This is a pancreas. يعني انك بس تعرف اهم شيء this is a pancreas. Those بدال بنسميهم شنو those are landmark. يعني نعرف بيهم the position of the pancreas. This is a pancreas. Also, this is a pancreas on this. What is this imaging modality?
MRI.
This is MRI, this is liver, this is spleen, and also this is a part of the pancreas. You can see part of the tail and body. The head is not seen clearly, but this is a MRI. This is endoscopic ultrasound. احنا قلنا endoscopic ultrasound يعني used for assessment of the pancreas, and هي عندها advantage انه can use for taking a biopsy. This is a بس تعرف انه this is a endoscopic ultrasound. There is a mass here, but you have to know this is endoscopic ultrasound, inserted endoscope through the mouth, which contain a probe to look for the pancreas. The last part of the gland are ovaries. The ovaries, as you know, lie lateral to the uterus near to the pelvic side wall. And during the childbearing years, the ovaries measure 2.5 to 5 centimeter in greatest diameter. But after menopause, they get atrophied. So atrophy when after the menopause. How these ovaries appear on MRI? The ovaries are intermediate signal intensity, intermediate signal intensity, and often contain multiple high signal follicles on T2. يعني إنها أهم شيء تعرف إنها intermediate signal intensity and contain multiple high signal follicles. High signal follicles on T2 weighted image. نشوف الكلام ده on the image. إلا تعرف إنها هي intermediate in signal and contain hyper intense follicles on the T2. طيب on ultrasound, there are many appearance of the ovaries on the ultrasound according to the effect of the hormonal. There is a the shape of the ovary depend on the stage or the phase of the menopause. During the early phase, there are many cystic structure can be seen. This representing the follicles. إذن in the early phase on ultrasound نحن نشوف الأوفري containing cystic lesion اللي هي دي بنسميها الfollicles. This is in early phase by ultrasound. Around the 8th day of the cycle, one of these follicles that's seen on the early phase become dominant, reaching up to 2 to 2.5 centimeter in diameter prior to the ovulation. إذن واحدة بتبقى dominant from these follicles that's seen in the early stage. At the ovulation period, the follicle ruptures, بيحصل لها rupture, and then immediately decrease in size after rupturing. And this gives rise to corpus luteum. اللي هي بيحصل لها شنو؟ degenerate if there is no pregnancy. إذا نعرف إنه in the early stage بيكون عندنا multiple cystic lesion in the ovary بنسميها follicles. Around the 8th day, one of these follicles become dominant over the others. هي اللي هي بعدها بيحصل لها شنو؟ rupturing to شنو؟ to give an ovum. Rupture this follicle, dominant follicles rupture and give the ovum. بعدها بيحصل لها regression or degenerate if there is no intervening pregnancy. This can be seen in this ultrasound. احنا قلنا ultrasound. This is transvaginal ultrasound. You can see this is the ovary. This is the ovary. قلنا the ovary contains multiple cysts. Cysts اللي هي anechoic rounded. These follicles. Those are follicles. إذا دي كلها this is all the ovary. This is ovary. On the periphery, normally there are many cystic lesions. اللي هي cystic areas. اللي هي دي بنسميها follicles. This is a normal ovary by ultrasound. This is a normal follicles in ultrasound in early stage. نحن قلنا on MRI this is MRI طبعا. This is MRI. This is a patient عنده septate uterus. This is uterus and this is uterus. There is a septum. لكن أهم شيء نعرف إنه this is the those are the follicles. قلنا follicles on MRI T2 بتكون bright hyper intense on both sides. لاحظت إنه عندنا small cystic areas اللي هي hyper intense bright on both sides. This is a normal appearance of ovum of ovary in the MRI T2. قلنا عندنا follicles or cysts of hyper intense bright on T2. Right. What is this imaging modality?
Ultrasound.
What is this region?
Usually ovaries.
What's this called? This one.
Ovarian
Cystic.
follicles.
This ovarian follicles. This is a normal ovaries. This is a normal ovary. And what is this?
This is MRI.
MRI. Yes, this is MRI. What is this structure? This is a coronal MRI.
Is this the uterus?
Yes, all right. Thank you. This is a uterus. What is this?
The follicles of the ovaries.
Yes. So this is a left ovary containing follicles, which are hyperintense bright. So this is the right ovary, and this is the left ovary, and this is the uterus. Now you have to know the ovary in this block or this part. This is the left ovaries, and this is the right ovary containing follicles. What is this imaging modality?
Ultrasound.
Also ultrasound. You can see also the follicles, the thyroid periphery, containing this follicle, multiple ovarian follicles. This is a normal. And what is this imaging modality?
MRI.
MRI also. This is the uterus, and this is the ovary, left ovary and right ovary. Ovary characterized by presence of follicles which are hyperintense in T2. We have to look right on T2. This is ultrasound and MRI demonstrate the follicles. This is all in this part, imaging of the endocrine. If you have any question, you are welcome.
Yeah, Doctor, slide 31.
31. Yes, 31.
Yeah, last 2 points.
Right. A major advantage of CT over transabdominal ultrasound and endoscopic ultrasound. Yes, these 2 points.
Yeah, Doctor.
Yes. طيب أول شيء تعرف إنه الالتراساوند is limited use in structure containing air. يعني مثلا in bowel. يعني ultrasound limited use to diagnose structure containing air. For example, bowel يعني. فنحن عارفين pancreas, the normal position of the pancreas is adjacent to the يعني anterior هو posterior to the stomach and adjacent to the bowel يعني especially the transverse colon, and the bowel and stomach both containing air. This air may interfere with propagation of the sound. So the imaging of the pancreas by ultrasound is not as good by this ultrasound. Why is that? Because the sound is not going to reach the pancreas. لأنه the sound دائما محتاج ل medium to pass or to propagate. And the sound نحن طبعا بنعمل تكنيك إنه عندنا probe. We put this probe in the anterior abdominal wall. This sound goes through the anterior bowel. بنعمل جل لذلك to make a medium. This sound to reach the pancreas should pass through the bowel containing air. So the sound does not reach the pancreas. So there is a difficulty in assessment of the pancreas by ultrasound for this region. And the pancreas is covering by the structure containing air. Results the CT is better than transabdominal ultrasound and assessment of the pancreas. This is the first point. Do you got it?
Yeah, yes, doctor.
Okay. The second point, endoscopic ultrasound is another technique. It is ultrasound, but done by endoscope, inserted through the mouth, through the esophagus. This endoscope this endoscope have a probe نفس البروب اللي بتعمل بيها الالتراساوند تراس abdominal but small probe put in the end of the endoscope, and this is called endoscopic ultrasound because done with endoscope, not with probe that put in the anterior abdominal wall. يعني بيسموها endoscopic ultrasound because this technique done with endoscope. فthis technique ultrasound with endoscope اللي هي endoscopic ultrasound used for routinely in assessment of the pancreatic disease, and this technique عنده advantage انه can be used for taking a biopsy from the pancreatic lesion, and this help in staging of the pancreatic cancer. You got it again?
Yeah, clear, doctor. And for the ovary, what's the best modality, MRI or ultrasound?
For, طبعا هي بعدها according to the patient presentation. طيب according طبعا هي الالتراساوند both can display the ovary. Usually احنا we start with transabdominal ultrasound. If it is not conclusive, we can do transvaginal ultrasound. Transvaginal ultrasound give us more يعني details and resolution بيكون better to assess the adnexia and the ovary. If it is not, you can jump to MRI. يعني there is no absolutely مثلا نقول لك إن MRI is better than ultrasound يعني زي others. يعني according to the patient presentation. لكن usually we start with the ultrasound because طبعا هي زي MRI cannot use a ionizing radiation available يعني cheap طبعا. If it is conclusive, it is quite enough. If it is not, you can jump to مثلا transvaginal. Transvaginal هي برضو invasive technique. This transvaginal ultrasound done with insertion of the probe to the vagina. It is a minor invasive technique. If it is not conclusive, we can run to MRI. يعني according to the pathology and according to the patient presentation يعني. But the initial investigation for the assessment of the ovary is ultrasound. Yes. Any more question?
Doctor, for
I have a question, please.
اتفضلي.
Okay, and goiter, doctor, thyroid gland.
Thyroid gland, yes.
Yeah, in case of goiter, which modality should I use?
In case of in goiter, enlargement of the thyroid. This نحن ultrasound is a imaging modality for thyroid, the best يعني. If it يعني إذا ما في retrosternal extension of the goiter, ultrasound is the best modality. If there is a retro extension of the thyroid goiter of the thyroid, this the CT is the best modality for assessment of retrosternal extension of the thyroid tumor or enlargement.
Doctor, can you use also plain chest X-ray?
Yeah, plain X-ray can be used. عندنا تكنيك معين بيسموه thoracic inlet. thoracic inlet يعني هو ما chest X-ray. عندها position معينة can be used for assessment of the but nowadays we use CT commonly rather than trans اللي هو قلنا بنسميها ما chest X-ray بنقول لها نسميها thoracic inlet. thoracic inlet chest X-ray بس البوزيشن بيختلف شوية يعني من النورمال chest X-ray. thoracic lid. يعني also plain X-ray can be used for assessment of the retrosternal goiter or extension of the thyroid into the thorax. لكن احنا بنستخدم commonly now CT more than X-ray.
Okay, thank you, doctor.
So Dr. CT is the first line for goiter.
قلنا إذا كان if there is no extension ultrasound, if there is no extension or يعني intrathoracic extension, يعني كانت in the neck only, the goiter enlargement of the thyroid but not reaching there is no retrosternal extension or intrathoracic extension. Ultrasound is the best.
So ultrasound, doctor, in the case of assessing like the anatomical appearance of the thyroid.
Yes, for the normal anatomy or for the abnormal thyroid. If there is an enlargement of the thyroid, but not causing retrosternal extension, ultrasound is the best, yes.
No, I mean for retrosternal goiter,
Retrosternal
CT is the best.
Yeah, CT is best than X-ray. X-ray can give us more. يعني here done for what? To look for compression of the trachea. يعني اللي هي pressure symptom means there is a deviation or compression of the trachea or X-ray can give us information, but CT is better than X-ray.
And better than ultrasound on retrosternal goiter.
Yes, yes. لأنه the retrosternal enlargement of the thyroid lying behind the sternum, that there is a difficulty of assessment of any structure. يعني عندنا bone and air both cause obstacle in the assessment of the tissue. لذلك إنه مثلا عندنا الترانس cranial ultrasound يعني usually not we are not use the ultrasound in مثلا brain tumor. يعني عندنا ultrasound عندها limitation, two limitation, presence of air and bone. So when the thyroid is located behind the sternum, the ultrasound is not as good in that case. لذلك نستخدم CT or MRI, and CT is better than and X-ray, plain X-ray.
Doctor?
Yes, welcome.
Yes, for ultrasound in the pancreas, it will give the same echoes for liver or higher liver. So it will become more brighter?
Yes, طيب on alt هي طبعا according to the age نتكلم عن الادلت. يعني هي البانكرياس it is slightly hyperechoic, يعني it is slightly hyper of more price than the liver and spleen. حتى عندنا term يسموه بليسك PLISK اللي هي بتوضح لنا شنو arrangement of the echogenicity of the pancreas, liver and spleen and kidneys. Pancreas is more hyperechoic than liver in the adult. يعني هي يعني slightly hyperechoic compared to the liver. Slightly not يعني اللي هي البانكرياس is the most hyperechoic structure in this in between the liver, pancreas and kidney. فالمهم
not
the pancreas is slightly hyperechoic. It's slightly hyperechoic compared to the liver in adults. يعني more bright. Hyperechoic means more bright.
Doctor, if I said hyper intense or hyper dense means more black or more
hyper anywhere means bright. Hyper intense means in hyper intense means this structure is bright
MRI.
on MRI. Hyper dense means bright in CT. Hyper echoic and so on.
And hypo black.
black. Yes.
Yeah, thanks.
Okay, so hyperdense is more brighter in MRI, and hypertense is, hypertense is more bright in MRI, and hyperdense is more bright in CT scan. That's the terminology.
Yes, density in CT. Yes. When we talk on MRI, in MRI, you have to use the intensity or signal, hyper intense or of high signal, or high signal. طيب, in this patient, to answer the question of the echogenicity of the ultrasound compared to the liver, if you look here, the pancreas echogenicity is similar to the liver, but in this one, the pancreas is more hyperechoic compared to the liver. According to the age of the patient, in adult, usually the echogenicity of the pancreas is usually similar to the pancreas or slightly hyperechoic compared to the liver. The echogenicity of the pancreas is either similar to echogenicity of the liver or slightly hyperechoic compared to the liver.
Doctor,
Yes.
in this slide, can you show us, please, the arteries and vein?
Yes. This is aorta and this is IVC. This is portal vein. And this is a splenic vein running horizontally. This is splenic vein. As you know, splenic vein joins the superior mesenteric vein to form this portal vein. This is a confluence between the splenic vein and superior mesenteric vein to form this portal vein. And this is superior mesenteric artery. So this is superior mesenteric artery. This is splenic vein. This is a portal vein. IVC aorta.
So what is the superior mesenteric vein?
This superior mesenteric vein is not seen here. It is it connects the splenic vein to form this portal vein. It is not seen in this axial section. This is a splenic vein.
Doctor, the small dot.
Yes.
The small dot, is it the artery?
The what?
The small dot that's below.
This one? This?
Yes. Yes.
This is superior mesenteric artery.
Okay.
Yes. And this is splenic vein. انتوا عارفين انه splenic vein and superior mesenteric vein join together to form what?
Portal vein, the one goes to the liver.
Yes, عشان كده هم ديل. This is a confluence between the splenic vein and superior mesenteric vein. They join together here to form this portal vein. This is a portal vein, which is formed by the junction of this splenic vein and superior mesenteric vein, which is not seen in this area. And this is the superior mesenteric artery, aorta, and you can see also what is this structure. This running behind the this is the aorta and this is IVC. What is structure running from the left to the IVC? This is this line, this one. Anterior to the aorta. This is the left renal vein running from left to empty into the IVC. But أهم شيء إنه landmark for the pancreas is, splenic vein, and this is the confluence between the splenic vein and superior mesenteric vein, superior mesenteric artery, aorta, and IVC. And this is the pancreas. This is the head, body, جزء من الtail. Is it clear? This is a transverse section.
Yes, doctor. Thank you.
Similar to the CT لو حصلها. حتى نفسها اللي هي دي. This is a body, tail, body, and head of the pancreas. Again, what is this?
That's the splenic vein. Or no, portal vein.
Yeah, this. And what is this?
Superior mesenteric artery.
Superior mesenteric is a branch from the what?
From the aorta.
This is aorta. This is superior mesenteric artery. And what is this? The
But
bear.
that
Where
IVC.
what is
IVC.
IVC and what is this?
Spleen.
Running here. This vessel.
splenic
Spleen.
vein.
Yes, splenic vein. This is splenic vein. The pancreas is located anterior to splenic vein and superior mesenteric artery and the superior mesenteric vein also. Superior mesenteric vein joins the splenic vein to form this portal vein. You have any? Yes. Welcome.
Doctor, just to be sure of the imaging modalities of choice for the pituitary gland. So in order to assess for the pituitary gland itself and any possible tumor, I would use MRI as my modality
Yes.
of choice.
Yes.
And
Ye-
okay, and what about the bone structure surrounding the pituitary? Do I use plain X-ray or CT scan?
The CT is the best imaging modality for assessment of the bone. If you are interested in the bone, CT is the best for to look for the erosion or even ballooning or enlargement of the pituitary fossa. CT is the best.
And what about X-ray then, doctor? If it says it's only used for hypophyseal fossa, then it's like an option, or is it considered obsolete? We just use CT scan now instead.
Plain X-ray can demonstrate the enlargement of the cell telsica. نحن قلنا in the past plain X-ray used in assessment of the hypophyseal fossa. لكن وجدوا مثلا عندنا patient عنده empty cella tertica. In this patient also there is a ballooning and enlargement of the pituitary gland. لأنه كان أول شيء بيقول إنه if there is enlargement of the hypophyseal fossa, this means there is a tumor in this microadenomas or and so on. فلذلك إنه بقى the CT is the imaging modality that used for assessment of the bone to look for the enlargement of the instead of the although the X-ray plain X-ray can demonstrate the enlargement of the pituitary fossa or ballooning or enlargement of the cella tersica. But CT is better than the X-ray. لذلك nowadays we perform CT for assessment of the pituitary for the cella tersica to look for any erosion or any enlargement of this fossa.
Okay, thank you, doctor. And
Thank you.
for the MRI section of the ovaries, the description for it, I didn't understand. Like, so the ovaries in appearance, when you do an MRI scan, they appear much more brighter. Is that what they mean by high signal follicles?
High signal follicles or hyper intense. High signal or hyper intense means bright. These follicles are hyper intense or of high signal. High signal means hyper intense. Low signal means hyper intense. But there are many follicles on both ovaries which are hyper intense or of high signal. These follicles.
Okay, doctor. Thank you.
Thank you. Do you have any more questions?
Doctor, for the OSP, can you tell us the most important?
Most important what? For what?
Yeah, what do you have to focus on for the OSP?
On the OSP, you have to know what is this imaging modality? This is MRI. The imaging modality is MRI. Yes.
Doctor, imaging modality.
Yes, the imaging modality. I'm going to stop there.